Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Now there was another interesting article in the Post about red meat can be a part of a healthy diet, and they talk about the circumstances under which red meat is of merit, and they emphasize the lean cuts of red meat and also the infrequency at which red meat should be taken if you're going to eat red meat. So it's a good article to read, especially those of you who still eat red meat and want to know how to do it safely. So I think that was very valuable. They also talked about kidney disease, and I talked about something we talked about last week about salt, about those who like their salt and they add salt to the food have an 11% greater likelihood of getting kidney disease. And it fits right into a question that was asked about salt and hypertension and kidney disease. Okay, John, I guess you can start showing the articles.
I'm actually going to do something out of order.
Oh, does cold weather make you sick? And it's an interesting article, which is kind of long, but it doesn't really definitively answer the question. It just says that viruses are more common and that the dry air associated with heating limits the ability of the nasal passages to keep the virus from getting in. And it talks about that the viruses also are more prevalent in the cold seasons, and that because the viruses are more stable in the colder temperatures, this may be another reason why we get so many infections during the cold weather, which we do. It's pretty clear that we have more infections during the winter season. So they talk about, and they've certainly studied enough patients to, and they talked about studies they've done all around the world that demonstrate that it's the good ventilation that's helped, and that the outdoors when the weather is warm is makes it harder to get the virus, while in the wintertime it's easier for it to happen. So it talks about the nasal adherers being the helpers, but that in the cold they aren't as much help as you'd want them to be. And because of the cold temperatures, along with wind, rain, and
destroy the cartilage that is in human joints, just like.
Okay, and so that so it is true that in cold temperatures you do have more colds, and talks about the rhinovirus and the influenza virus, and of course now we got the coronavirus and the RSV virus, and all of those are more likely to affect us in the wintertime. And especially if you're an asthmatic. So it's the combination of the viruses as well as the cold temperature that together make us very vulnerable in the wintertime. Any comments or question about this article, which is timely? Oh yeah, this is the next article that talks about racism impacting the breast cancer outcomes. I think that areas that are where we like have been associated with high mortality rates, especially among Black women. And breast cancer is killing a Black woman far more than I'd like to see. So many of my female friends have died from breast cancer, and particularly younger females in their 30s and early 40s. And this is, and talking about the estrogen receptor negative status, which is the harder to treat breast cancer. And this looks at the estrogen negative versus the odds for women living in historically redlined areas, which are the areas that we, 97% increase in odds for estrogen, 62% of estrogen negative, 97% for late stage cancer, and for breast cancer, mortality overall 60%, which is pretty high, especially since you try to make an early diagnosis and implement treatment to avoid mortality from breast cancer. So this is a concern, and of course, the environment has something to do with it, and the food deserts and other things, as well as the social determinants of health. Non-Hispanic white women also had associated mortality that was twice that of this. Well, it's clear. I'm glad that they close it out by saying that the race is a social construct, and so that much of the problem is associated with where we live and the environment in which we live, and so that the social determinants of health, as Harold Freeman identified in 2000, is an extremely important part of the equation, as is the opportunity of women, once they make the diagnosis of breast cancer, to get the appropriate treatment. And so if you get an early diagnosis and get implementation of treatment as soon as possible, the reduction of breast cancer mortality is there, but still at the end of, when you look at it, you still have far too high a death of young Black women. Any comments or question about this disparity that persists? I'm sure all of you have encountered younger Black women who died from breast cancer.
Yeah.
I think we must have at least 6 of our surgical women that we've trained who died of breast cancer.
Mm-hmm. Mm-hmm.
Any comments about that last article about breast cancer? If not, this next one is interesting because Florida's Surgeon General refuses to bar unvaccinated students from school suffering a measles outbreak, which makes little sense to me. But anyway, that he's been doing a number of things like that. Uh, he's very skeptical about many things that conventional medicine is associated with. But his ideas relative to measles is a little startling because it's not only unconventional, it's risky for the children who are unvaccinated to be allowed to come to school is, to me, is inappropriate. But anyway, one thing about this country, you have people who sometimes do things that are contrary to what is thought to be common sense. It's the same one who feels that the vaccine is unsafe.
Uh-huh.
Yeah. So, any comments or questions about this? What are your thoughts? Should the unvaccinated kids be allowed to come to school?
No, they shouldn't.
Simple.
No.
But when you have a physician who, in spite of his knowledge to the contrary, still persists in doing things like this, it makes you wonder why.
Measles is a fast spreading,
And lethal, yeah.
yeah, that's what I thought. Yeah. It's growing.
There's an article that talks about the extent of which the measles, which is really we had none, virtually none, and now see it more.
So I had a question, Dr. Callender. The argument seems to be more based on rights, whether, whether you have to do something because the state says you have to do it.
Uh-huh.
That's a shaky argument. Yeah, yeah.
The other
Especially
thing,
when people die
Callender,
because of it. I'm sorry?
yeah, the other thing is that we have a vaccine for measles, and so I don't see any reason why we wouldn't take advantage of it.
I don't either.
There's some people that are just afraid of any kind of shots, injections. I knew someone once where kids have to have so many shots before they enter school. And this person was taking his child to the doctor and giving the nurse some money to say, write that up and say I had the shot, because he didn't want the child to get the vaccination or whatever. And it made no sense to me at all, because you're hurting the child. But he's meeting the requirement by taking the paper back to school to say the child got a shot. Some people just think differently. They, you don't know nowadays how people think.
I have heard that some of the parents didn't want their kids to take the shots because it could cause autism, or if there's too many of them together at the same time. I've heard that. I don't know if there's any truth to it or where they got the information from.
Well, most of the data suggests that is not accurate. Now, there are side effects of vaccines, and there are side effects, so that there have been the rumors about autism, but it doesn't seem to have been substantiated. But that still is being passed around, but there are legitimate side effects of vaccines. but to have people who are unvaccinated, who don't have a medical reason to be unvaccinated, going to school is dangerous. And you're right, there are people who because they have witnessed side effects, they're afraid to be vaccinated.
Mhm.
I
And there
never
are
had
some,
measles.
you never got the vaccine?
I never had measles or the vaccine. Should I get the vaccine now?
No.
Kind of late.
You mean you
Okay.
went to school all those years and
Wow.
wasn't vaccinated?
Right.
Yeah. Well, if measles comes to Chicago, yeah, you would need to have the vaccine because it's a mean disease. And if you have not been vaccinated, it's conceivable you could contract.
I know when I was a kid, we had to get the vet. We didn't hear that much about people who wouldn't vaccinate their children. If they were around, we sure didn't hear about it.
Right, because they didn't come to school.
No, that's true.
Yeah.
Yeah. So
Yeah, as John Buchanan said, this is an era in which people fight for some rights that they believe belong to them. But what they are forgetting is that that also is a right to cause people to be sick because you didn't follow the rules. And you could have people die as a consequence of making decisions like that.
Mhm.
sounds like the more knowledge they get, the more dangerous they become.
Mhm.
Yeah.
Crazy.
I know I had the measles twice. So Darryl, I may have had the measles for you the second time.
Mhm.
But understand that measles are harder on adults when they get older than on younger people.
Right.
Dr. Callender,
Yes.
is there a difference between measles and German measles?
Yeah, there are two types of measles. Yes.
Because I got both of them.
Yeah. 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 And when I was growing up, yeah, we talked about the German measles as well as measles, two types of measles.
But the danger with those children coming to school is that other children have brothers and sisters, or they even may have brothers and sisters that are too young to get vaccinated, and they could get vaccinated, or a pregnant woman could get infected. Is that a possibility?
Yes. Yes,
Mhm.
it is. And so that's a dangerous thing for the Surgeon General of Florida to be doing. But I guess
We
he
got a
doesn't.
freedom to be stupid these days. People are
Well,
utilizing that freedom very frequently.
yeah. Okay, let's go to the next one. Yeah. Grandparents may have a significant impact on a mom's mental health, wisdom and experience. And that's kudos to uh, your grandparents out there, although this is Helsinki, Finland, where there aren't too many people that look like us. But uh, uh, this is something that is likely to be true everywhere. Grandparents have of course, that's only true if the parents of the children recognize the wisdom of the parents and of their parents and allow them to take advantage of their wisdom and experience. Because the grandparents can be a formidable source of information.
Shout out to all grandparents on the line.
Mhm. Mhm.
Yeah, yeah. Thank you.
You're welcome.
There are so many who don't have the advantage of having grandparents to help raise them. So it's a great blessing to have grandparents. An even greater blessing when the children recognize us and take advantage of it. It's interesting, the maternal grandparents are so much more sensitive to a lot of these things than are the males grandparents.
That probably goes back to that saying, mama's, what is it, a woman is and a man maybe. So we know the woman, yeah, is, so the man just maybe. So
Oh, I don't know about that.
we're more protective.
Well, I think you are definitely more protective. I'm not sure about the reason, but I do know there's no question you're much more protective and much more sensitive.
Daddy's maybe, mother's maybe.
Maybe.
No.
Mama's baby, daddy's baby.
Yeah, there we go.
Yeah.
We cling closer. Yeah.
You cling forever, right?
Yeah.
Only except this is if the mother and daughter have a good relationship. If they don't have a good relationship, because there are some daughters and there are some mothers that overstep their boundaries, and mother and daughters don't necessarily get along. Generally, yes, but there are some exceptions where mothers and daughters just can't get along until the daughter maybe matures or the mother stopped trying to run the daughter's life.
And that's funny how the mother-son relationship is so tight most of the time. And as you expressed it, the way in which the mothers and daughters may or may not get along for a while. They eventually understand that mom knows what she's talking about, but sometimes it takes a little longer.
I heard an expression that said, the older you get, the wiser your parents. You realize the wiser your parents are.
So true.
Really? Yes. Amen.
Amen.
So true. So true. Yeah. And then you wind up doing the same thing your parents did.
That's right.
And you said, I'd never do that to my children.
Right.
Yeah. So.
And the mothers and daughters-in-laws are another issue all alone.
Yes. Yeah. That is another issue. Yeah. There's a battle that goes on. Right. Untreated sleep apnea presents many dangers to people's lives, including heart issues and cardiovascular disease in general, hypertension and other vascular diseases. And this is why, particularly in people of color, that they recommend having your obstructive sleep apnea treated. And there's data that supports much of this, that this sleep apnea is associated with so many consequences of hypoxia, low oxygen levels. And for reasons we're unclear on, it is particularly common among people of color. And they showed a CPAP machine. There, of course, is another alternative where they can do an operation on you that avoids the use of CPAP.
Dr. Callender, I have a question. Hypoxia. Does a person die from hypoxia, or does the hypoxia cause the heart to stop?
Same change. People die from hypoxia. Hypoxia is lethal. Okay, so that you cannot live with hypoxia. If you have a CO2, if you have an oxygen level that's less than 90, your tissues are not going to be well oxygenated, and to the extent to which that continues, you will die. First, of course, you get hypertension and many other problems, but hypoxia is a lethal condition. Levels below 90% oxygenation are associated with death. And one of the things with obstructive sleep apnea is that you're fighting to overcome that, and that's why you take those real deep breaths. But it's not adequate, and so you have chronic hypoxia, which may not get down to below the 90s and kill you, but it causes other problems, which reflect themselves in hypertension, in hyperirritability, and being chronically fatigued.
Dr. Callender mentioned before that they have an ad on the TV now about Inspire.
Yes.
You take this device and just click it, and it's supposed
Well,
to.
but you have to have surgery to put it in first, and then after they put it in, then yes, then that's all you have to do.
I'm just wondering how that works, and how expensive that surgery and the device is. You have any idea?
But I tell you what, let's talk about that next week. I'm going to look it up. I looked it up once, but I didn't see the cost of the treatment. But it is a procedure that they have to do that allows you not to need the CPAP. But I didn't find out the cost. I'll have to look that up, because you're right. That's a very common ad, but they don't go into details because you have to qualify to have the surgery first, and then after the surgery, then you don't need the CPAP machine anymore. Not everybody is a candidate for it. So let's talk about that next week in detail, and I'll find out about the cost as well.
All right.
This is interesting headline for an article. This could be a strong weapon for cancer pain or any pain. And then when you read the article, you find that they're talking about physical activity and exercise. And they did this studying exercise more than 60,000 people, including 10,000 with a history of cancer. And they surpassed 150 minutes of activity, and they were less likely to have pain than those who did not get the physical activity. And so this was true not only for cancer, but for all conditions. And so they're recognizing that exercise is an awesome way of reducing pain. They haven't figured out the mechanism yet, but they do recognize that it has been treatment for back pain and other painful conditions. Isn't that interesting? That's interesting that exercise is pain medicine. Yes.
Oh.
Suggesting that there's psychological factors that have to do with it as well as physical factors. And they talk about the importance of social interactions with others, also helping, and then also having a positive perspective, being helpful as well. Any thoughts or comments about the fact that exercise, physical activity can be such a pain reliever?
You definitely feel better after exercising, even if it's just a little bit.
I know for sure that I had like bursitic pain in both shoulders. And even in my hips when I had to walk when the pools were closed. And I had to take medicine to relax muscle relaxants to get rid of that hip pain. And I had the shoulder pain again when I started swimming. But now you know, since I've been doing the swimming regularly, I don't have the shoulder pain anymore.
Wonderful.
It went away.
Yeah. And nothing like that bursitis either, is it?
It's pretty debilitating.
Yeah. So let's go to the next one. We've talked about this super common issue often. Darryl has talked about it a lot in terms of being able to hear and blasting all that music into your ears. And almost all studies now are pointing out that the incidence of dementia is increased with hearing loss. And for those people who have hearing loss and don't get hearing aids, the incidence of dementia is very high. 60% higher prevalence of dementia for those people who have hearing loss and don't do anything about it. So it's important to reiterate that so that those of us who have hearing problems would get hearing aids and help themselves and perhaps decrease the likelihood of them getting dementia as they age. There was a study that identified that close to 2/3 of those people who have hearing loss do nothing about it. And you know, if you go in a room with older elderly people, you don't see too many people with hearing aids. It's not because they can't hear; it's because they don't believe that the hearing aid will help them, or they don't want to be, or there's a kind of a stigma to having a hearing aid. So I remember when I first started wearing my hearing aid. I also was amazed that most of the older people had no hearing aids, but after a while you get over it because you realize the benefit.
My comment would be that if you think you have a little hearing loss, then your hearing loss is at least double what you think it is. If you think, well, you know, maybe it's 10, 15%, chances are it's 40 to 50%. And your life will be so much better once you can start actually hearing.
Yeah, so better for you and the people who speak to you. And they talk about you musicians who are around all these loud volumes of music.
What did you say, Doc? Okay, say what? Say what?
John has told us, Buchanan has told us about his history many times. So You want to share it again, John?
Well, part of it is that I was on stage next to one of the loudest drummers. He ended up playing with Miles Davis, and his crash cymbal was like right next to my left ear for about 10 years. And I had speakers behind my own keyboard speakers were right behind me. So volume on stage was unregulated to say the least. And I didn't realize I had loss until I had to have an annual physical for scuba diving. And then I found out that I definitely had high frequency loss in my left ear more than my right ear. So, and they recommended hearing aids, but for some reason I didn't think I could afford them. They were very expensive.
This is another article that talks about the fighting memory loss and Alzheimer's, and most of the elderly people who have these hearing problems wind up with Alzheimer's. And so it is important to recognize and take advantage. Of course, the hearing aids aren't as expensive as they used to be, but a good hearing aid is worth its weight in gold. It's interesting, he says a lot of it is due to not paying attention. Well, you can pay attention, but if you can't hear, you can't hear. And a lot of the time, people read lips, and they don't realize how much they read lips until they find out that they really have hearing loss. And it's interesting suggestion that 40% of Alzheimer's cases could be prevented or delayed.
Dr. Callender, my mother would say, let me put my glasses on so I can hear what you're saying.
Oh, yeah, that's right. That's interesting. But that's what we do. We read lips a lot. And you don't realize it until you get it.
That's really hard with a mask on, though.
You're right. Yeah. Well, a word to the wise is sufficient, they say. So you've had many words of wisdom. And let's go to the next one. This is an article that it says that if you have a stroke, that's important to lie flat until you get treated. It doesn't say instead of treatment. It says until you get treated, because every moment that you spend not getting your stroke treated, you lose maybe a couple of million brain cells. So while you're waiting, you should lie flat so that the brain damage is less. And that's remarkable because that's very simple. But it doesn't place doesn't take the place of the thrombectomy, taking that clot out. But in the meantime, it does allow your brain to have circulation that it wouldn't have otherwise. It's amazing sometimes some things are so simple that you can do to make things easier for you. And this is a finding that they made. The delays may often be the operating room is not available or something else. So in the meantime, we have lay flat. And it's true in the hospital that the hospital beds are elevated, and that's against the benefit of the lying flat. Almost always the head of the bed is elevated. So
Dr. Callender, on that
yes,
point, if you have a bed that your feet can rise up and your head can rise up, what's better? Generally speaking, what's better? Because I know that when your ankles are swelling, if you raise your feet, you know, your fluids will drain down towards your heart.
that's correct.
And so, and maybe that's a good thing. And then what about when your head is up? Is that draining toward the heart as well?
Well, but the point is that we're only talking about if you have a stroke. If you have a stroke, you have a clot in that prevents blood from going into the brain. And so for that situation, you need to lie flat. Whereas there's no question that if you have fluid in the legs, elevating the legs is a benefit. But for a stroke, that's just the opposite. It seems that lying flat helps you to develop the collateral circulation that will help supply the brain even with the clot in place. Did you understand that, or did I make that
Yes, I
clear?
did. The only other question was, in cases when there's no stroke involved, it's okay to, I mean, when you raise your head area, things drain as well to your heart. Is that correct?
That's correct.
Okay, thank you. That answers my question.
Yeah. Okay, let's go to the next one. Yeah, it's interesting that, of course, most people don't know about vagal nerve stimulation, and that requires somebody to do that for you. But it appears that for stroke patients, vagal stimulation improves the likelihood of the hand and arm function, so that you decrease the likelihood of being paralyzed and regaining the function of your arms and legs if they stimulate the vagus nerve. And that's something that physical therapy is trained to do. And
Where's
yes,
the vagus? Where's the vagus nerve?
the vagus nerve is in the neck, comes from the brain down the neck, goes by the heart, and goes actually down to the stomach as well. But they have a way of vagal nerve stimulation that doesn't cause a lot of pain or anything, but it does stimulate the nerve, and that has been shown over time to decrease the amount of paralysis that you have in your arms and legs after you have a stroke.
How do you stimulate that nerve?
Sorry?
How do you stimulate the nerve? How is it stimulated?
They use electricity and
So, mhm,
in physical therapy. They
okay.
hook you up to a machine and they administer it to the nerve.
How could an acupuncturist work since they work
I'm
with the
sorry?
nerves? How would an acupuncturist help since they work with nerves?
Oh, acupuncture would help as well. Because acupuncture also uh, stimulates nerves as well, but they use a different technique.
Yes.
And for example, down here it shows that there's some type of electrode in the neck and stimulate the vagus nerve. So it requires some expertise to do that. Now, acupuncture is a little different, but acupuncture has been shown to be a benefit in so many different ways. And those who practice it can tell you. But this is a different technique in which they have an electrode that stimulates the nerve, the vagus nerve. Now, this is the same nerve that is associated with people fainting. So that has to be done by people who know what they're doing with the electrode treatments.
Is the technique similar to an EMG, electromyogram?
Well, EMG is a little, one would argue that it's a little more painful than that because the EMG actually, they check your muscles' ability to function. And so they stimulate a lot more. And sometimes people find that very painful. And with this electrode placement in the neck, it's not as painful as an EMG. Most of my patients who've had EMGs consider that to be a very unpleasant experience. Have you
Yeah,
had one?
yeah, I had one for carpal tunnel tests, and it was painful.
Yeah.
You know, I shared that I had drop foot after my hip surgery. And I know when I was in rehabilitation, therapy, they put electrodes on my legs. They would feel for my nerve, I guess. And it put the electrodes there to stimulate my nerves.
Did it work?
I don't know whether well, I'm sure it helped, I guess, but I'm beginning to get some feeling, but my foot is still dropped, but I do have a lot more feeling than I had in the beginning.
Okay. So this is something if you had a stroke and you go to your physical therapy, it's something that they have used successfully. This is an article, it seemed to me that every 6 months we're talking about what should the blood pressure be. And we've gone from 140/90 to 120/80. And we've even said for all the patients should be 150/90, but I still believe that the target should be lower than 130/80. That's I think if you're in the 120s, you're probably okay. And so that no higher than 130/80 is probably, and they talk about for older people. But to me, the figure 120/80 is probably still, if you're in the 120s, it's okay. I don't think that you should be happy with pressure that's 140/90. But anyway, this is something that seems to change every 3 to 5 years. We have a different target. And the reason is that they have demonstrated that the lower blood pressure target was thought to give you a lower likelihood of mortality and morbidity. But they are now saying that their studies show that if you're between 130 and 140, you don't have an increased risk of MI or any of those other things. So they consider the optimal blood pressure 130/80. Particularly for the diabetics who are more likely to have the stroke or heart attack or kidney disease. But they have concluded less than 140/90, which is we can live with. Any comment about that? What did your doctor say? Any of your doctors say anything about what pressure you should have? Did they share that with you?
Under 130.
Okay.
130 or less, he told me.
Yeah. All right. Well, it's food for thought, but I think that we're learning and looking and reevaluating, which to me is a good thing.
And speaking of food,
sodium versus potassium, and we talked about a little bit about this last week, in that salt substitutes are really potassium, and so sodium increases the blood pressure. Potassium will lower the blood pressure, and so and we know, as people of color, more likely to have salt retention issues. And as a consequence, many studies have demonstrated that decreasing the salt intake will decrease the blood pressure. And many of the diets take advantage of this. And somebody asked me last week, I know it was at church, somebody asked me, why is it that we have why are we so salt sensitive? And I'm not sure I know the answer to that, except that it may well be in the Middle Passage that many of the people who were left behind, shall we say, in the ocean were people who could handle salt. But those of us who made it did not handle salt well. And it may well be that we therefore have to be very careful about our sodium intake. And so I kind of recommend to most people that 3 grams of sodium a day is probably more than you need, but it probably won't hurt you. Actually, people who I put on salt retention, to salt diet, I actually put them on 2 grams. But I think if you shot for 3 grams, you'd be okay. And if you just didn't add salt to your food, you'd be okay. But for those who want to use salt substitutes, keep in mind that it's really exchanging sodium for potassium.
Stay out of restaurants.
Say again?
Stay out of restaurants.
Yeah. That's and there's many people who are saying all you gotta do is, as Darryl has said, eat your food at home. Uh,
Agreed.
Dr. Callender, um, the thing about sodium, you mentioned about adding sodium. If you don't, table salt, they call it. I mean, if you just don't add any table salt, you should be okay. But I had a theory that when we came over here as slaves, our ancestors were given the saltiest parts of the food, the pig and all of the other bacon and all that kind of stuff. Our ancestors ate the leftover parts of the pig. Have you heard anything like that?
yeah, but that to me doesn't explain why we're so sensitive. But yes, that's true. That is we did eat what was left over. So we got the worst of everything. Yes. That's a fact. Yeah. But I don't think that explains why we are salt sensitive.
Perhaps having PTSD from the Middle Passage. I find everyone who lives in the hood has PTSD.
Say that again.
I find that perhaps it's from just PTSD from that Middle Passage to present, and even some of the people now that fight or flight emotion that they constantly continue to have.
Yeah. Okay.
Possibly.
Yes. Could well be. But I think once again, as somebody had mentioned, the practice of, of doing most of your eating at home and will help a lot.
Yes.
Let's go to the next one. Why do we keep harping on high blood pressure? Let me ask that question. Why do you think we have so many articles about high blood pressure?
Because it affects everything in our body.
Yeah, that's right. And the number one cause of death is heart disease. And the number one risk factor for it is high blood pressure. And so that's why we talk so much about it, because if you can have a normal blood pressure, you can eliminate many of the diseases that are killing us. And so that's why there's all this fuss about going from 140 to 130 and 120. And so it's hype that is well deserved because and we've learned through time that the best that actually 1 out of 4 people who are being treated for high blood pressure, only 1 out of 4 of them is the blood pressure actually controlled, and which means that 3 out of 4 people who have hypertension are not adequately treated. And so it's important for us to realize that the best place to get your blood pressure checked is where?
At home.
At home.
Absolutely. At home. At home. And you should be doing it. And you should keep a record of the blood pressure that you have. And then when you go to the doctor's office, you can get it done there too. But the best pressure that you get is the one that you do yourself at home. And so encourage us to get blood pressure monitors and monitor it, because you are the best monitor of your hypertension. And you share that with your doctor so he knows whether the medication is working or not. And, you know, in our screening efforts, most of the patients who are hypertensive are those people who know they have high blood pressure and they're not taking their medicine properly. So we need to take more control of our own blood pressures and take the medicines that the doctors give you, but test at home to see if it's working. And if it's not working, then you need to let your doctor know, and he can modify the medications as necessary.
Dr. Callender, last week we talked about this, and so my husband has always taken his blood pressure because he's a diabetic, so he keeps track. I rarely take mine, but he told me that after last week, he said, okay, you're going to start taking your blood pressure. So he has a cuff, he has a cuff blood pressure machine. So I took mine, but I had 3 or 4 different readings in a matter of minutes. So I guess what I'm asking is, can the machines be wrong?
No.
Or
well, I think here's what you need to do. Machines can be wrong, but it is more likely that you have to recognize that you should actually be conversation free and activity free for at least 10 minutes before you get your blood pressure taken. There you go.
okay.
And then it's not wise to take your blood pressure too frequently. I think, you know, if you take your blood pressure, take 10 minutes to be free from everything else, get your blood pressure once or twice, just to make sure that that you've rested enough and that your heart rate is around 80, and that you're and take the loss of the 2 pressures as the pressure, okay, and do that probably twice a day for a week, and then after that, once a week. It should be adequate. But you should record it so that you know exactly what it was. But recognize that, yes, if you take your pressure right immediately after you sit down and do it again, it won't change over time. So give yourself about 10 to 15 minutes of peacefulness, and then take your pressure. And then,
Okay.
Okay, does that help?
Yeah, that does help. I had been sitting, I waited until I was calm, but it was up kind of high. So I said, well, maybe it's the machine. So I just hit the button and took it again.
It's probably not the machine, but it's probably the fact that when you change positions, things happen like that. So,
Oh, okay.
so you could wait a good 10, 15 minutes and then take your pressure once or twice and
I'll report next
accept
week.
it, and then accept whatever the recording is.
I'll report next week how I did.
Okay, all right.
The other thing is, you take your blood pressure and it's real high, and the anxiety about having high blood pressure makes you take it and it's even higher the second time.
But now, that could be. But now, by the end of the day, later on that evening, I took my pressure and it was low. So it was
right.
like
Yeah. Well,
15.
yeah. Well, and it's a good idea to get initially to get a pressure in the morning and a pressure in the afternoon.
So
and
anyway, I'll give you a report next week. See
okay. All right. Okay.
Dr. Callender,
Yes.
I think one thing that wasn't discussed that's very, very important is the fact that the sister who is speaking, her husband loves her. He loves her enough to get her to take her blood pressure. It's amazing. That you should go and give him a kiss. Because
he's listening, so I'm gonna have a hard time all the rest of the day. I know.
yes.
Yeah, Dr.
Thank you,
Callender,
Dr. Perez.
one thing that I recommend on your chart that you record your data, your blood pressure, the date, the time, systolic, diastolic, the pulse,
Absolutely.
and your comments, because sometimes the comments can tell you what's going on that day, whether you took the blood pressure after you had a meal or after exercise, or sometimes the comments can help determine why your pressure is high or low.
Good advice.
Should you
One other
take it before you
recommendation is
eat
that some doctors will recommend that you look away from the machine when the machine is calibrating, because sometimes that can bring anxiety.
Yeah, that's right. That's right. Good idea. Good idea. Okay. Any other comments?
I used to get mad when I went to the doctor and had to sit there for 10 or 15 minutes, before my physical. And now I realize that the reason for that a big time is for you to settle down.
Right.
The
Right.
blood pressure to modulate.
Right. That's right. Exactly right. Mhm. Okay. I think somebody made a comment about tapering off medication too fast causes a rebound effect in which your pressure goes completely too high. And so be careful about that. You have to, if the doctor's gonna take you off medication, they'll taper you off of it gradually, but you don't just stop taking the medication, because that causes a rebound hypertension, which could trigger a lot of negative interactions. Any other comments or questions about this very important topic? Now, this is a interesting take on niacin because it's a vitamin that is linked to a lower risk of all-term cause mortality, metabolic associated steatotic liver disease. Remember, they've changed the name of non-alcoholic to metabolic dysfunction associated steatotic liver disease, and that vitamin niacin has been associated with remission of the fatty liver, which has been associated with mortality, and also with developing cirrhosis, and of course, once you get the steatotic liver disease, that cancer or a transplant becomes necessary. And so this is interesting to know that taking niacin may overcome that effect. So it's a good thing to know. And I don't know how many you take vitamins, but this is a relatively new finding that association of niacin reducing the impact of non-alcoholic fatty liver disease. It's relatively new information, so whether or not people know about it or not is because it's relatively new.
Dr. Callender, is
Yep.
niacin naturally found in some foods?
Yeah, in leafy vegetables, it's a B vitamin, and yeah, leafy vegetables. Yeah. Now, there's been so much talk about omega-3 that I thought we would include this article on omega-3 and the good, bad, and the ugly about omega-3, because there seems to be clear evidence that this improves cognitive, cardiovascular, and mental health, and that It's commonly found in fish oils and many other products. But I doubt if there's anybody who's not heard about omega-3. So I thought it was good to look at some of the science behind omega-3. And I think I've been hearing about omega-3 since at least the last 20 years. And you can go down the line and look at some of the different analyses, but the bottom line is that they are important components of cell membranes, and so it's a healthy product. Darryl, you have any comments about omega-3? This is an article that points out. Yeah, go ahead.
Not really. Outside of people think that seafood and fish oil primary sources of omega-3, but there's a lot of plants that have omega-3 too, and so you can avoid omega-3 deficiency while still having a plant-based diet.
Oh yeah, absolutely. Thanks for underscoring that. Its effect on depression, I'm not, although they have studies that suggest it does help depression. Anybody not heard anything about omega-3 and its association with good health and
I know Dr. Callender for West Indians. It was cod liver oil that I couldn't drink after I became an adult. I wouldn't drink orange juice because of my memory of cod liver oil, because it was evasive. Take that I can remember the yellow paint in the kitchen. I have so much post-traumatic stress from cod liver oil.
I remember that well also. I don't know how many of you had the experience, but yeah, cod liver oil, that was it.
It's a tablespoon too.
Yeah.
Saying the same thing. He remembers it too.
Yeah, man. And it was always with orange juice. It made me hate orange juice. You're right.
When I had my physical last year, my doctor said bring all your medicine and supplements and everything that you were taking. He took me off of the fish oil pills that I was taking. So I was wondering about that. My previous primary physician that put me on had suggested fish oil and glucosamine chondroitin that I was having joint issues, especially knees and hips. But this doctor took me off of both of those. So I was just wondering, any research about any negative side to the fish oil?
I don't know of any, but the chondroitins has been subject to a lot of discussion, some pro and some con. I don't know what the final analysis is. Fish oils, of course, the extra virgin fish oils are thought to be good to preventing cardiovascular disease. That's the extra virgin variety. But Darryl, you have any thoughts about that? Dr. Perez?
No, I don't. But I was just going to do a quick search on how much omega-3 was present in olive oil.
Right, and be sure to look up the extra virgin aspect of it. That's the part that is recommended for fish oils.
At a certain point, they were talking about the mercury that was concentrated in the fish oil.
Well, that's in that. Well, okay.
It is interesting. When I was reintroduced, go ahead, I'm sorry.
Say again?
When I was reintroduced to cod liver oil, I'm from Southern Virginia, and I went into the grocery stores because you could always buy it there, looking for cod liver oil. It wasn't there. So it's like been remarketed or repackaged. It's something that's healthy for you. So now let's make some money off of it.
Any other comments?
I'm listening to all these cod liver and castor oil.
Oh,
talk,
don't say castor oil,
but
please.
but
Don't even mention it.
Fortunately, I love orange juice, and I guess it's because my dad was a Watkins distributor, and we grew up on Watkins products. I never took castor oil. I never took cod liver oil. So I don't know anything about that. I love orange juice. I use menthol camphor ointment and liniment. That's what we used in our family. And I still use it today.
Okay, okay.
That we were so poor. The slice of orange. We couldn't afford orange.
My husband is saying they were so poor they didn't get orange juice. His mother just cut an orange and gave each one of them a little slice. And after they took the cod liver oil, they had to bite it.
Oh, wow.
I agree with your husband. We took castor oil, and it was 8 of us. She'd line us up and give it to us. Didn't get orange juice. You got a slice of orange.
There you go. Amen.
Yeah, I'm looking
but
at a
it
chart.
speaks to the resilience of our community. How our people took the as natural as possible to give us a fighting chance. It's the resilience.
Darryl?
I'm looking at a chart of food content by milligrams per 100 grams of food, and cod liver oil is a king at 24. But let's see, bringing up second place, there's walnut oil at 11.5, or rapeseed oil at 9.6. Olive oil is not a very good source of omega-3. It's got a lot of other benefits, but it's only 0.7. But if you want to stay away from seafood or animal-based products, you could avoid the cod liver oil, but take twice as much walnut oil as you would cod liver oil, which is just a teaspoon or tablespoon anyway. But you won't get the stank face that cod liver oil gave you, or the PTSD from the bad taste. Walnut oil is actually pretty good.
Thank you so much. Any other comments before we go to the next article? Okay. This is an article that my daughter suggested because they felt that we talk so much about hypertension and other things that the real issue is to prevent any of those things from happening. And so this article then talks about what do you do to prevent getting any of these risk factors before they start. And of course, we know the secret to that. And the secret to that is developing a healthy lifestyles and the things that we talk about. We talk about exercise, we talk about meditation, we talk about plant proteins, and I think those are that's the way you prevent from getting some of these things, and that's where this article says the emphasis should be on trying to get away from that an ounce of prevention, as we all know, is worth a pound of cure. And as you go down on this article, it kind of points out that the things I mentioned, the exercise, the dietary changes, those are the things that hopefully keep you from needing the medication that occurs when you develop hypertension. And so also getting your cholesterol level to see if you have a hyperlipoproteinemia, which will cause heart disease that also will cause you to have heart disease. And so I think putting the emphasis on doing those things that demonstrate behaviors that would prevent you from getting these things is something that we emphasize anyway. But I think that many of the articles don't emphasize the ounce of prevention that is so important. And of course, when you have food deserts and you have to go to McDonald's and those places, and you eat at restaurants and those kind of things, those are the things that we need to avoid, and the things we need to do all along to keep from developing those end products of poor healthy lifestyles. And I think our emphasis on reducing or avoiding meat, emphasizing fruits, vegetables, emphasizing exercise, emphasizing meditation, along with other things that do the same thing. Like I haven't mentioned yoga, I haven't mentioned some of the other healthy lifestyles that we can adopt that really are what are the mainstay of how to prevent from getting some of these chronic diseases that plague us. Any comments? Because I think this is something that we talk about almost every session, but it's something that is worthy of repeating. That an ounce of prevention for all of these chronic diseases is worth a pound of cure. Any comments about that? Dr. Perez or anyone else?
No. I know they say meditation, but prayer.
Prayer is meditation.
Yes, that's what I was going to say. Having the opportunity to pray, and
spending as much time to pray as you do in exercise or more. I think I probably spend more time meditating than I do exercising, but the balance is nice. But I think that I think one of the ministers corrected me just like you did. He said, I said meditation, he said prayer. Well, they're both the same thing. I say meditation, you say prayer. I say prayer, you say meditation. You're getting close to your God is something that's important. And some people meditate and don't pray to their God at all. They just meditate. But I think I'm glad you made that comment, because I've had others make it before. Any other thoughts about that in terms of meditation? And there's so many types of meditation. That's why I use that term, although prayer is a form of meditation. Any comment about that?
I think we unconsciously worry mindlessly without controlling those thoughts that are constantly flowing through. And I think it affects us, affects high blood pressure and other things. I recently took one free class of Wuchang Tai Chi, and only one class. I'll go back. It was very, very helpful. It was like meditating while moving. And for me, it just took all those thoughts away. I was just totally focused on movement. And of course, that's like a form of meditation, and it was very helpful.
Thank you for sharing. Anybody else want to share?
Yeah, Doc, and everybody, for me, prayer is like talking to God, and meditation is like listening.
Mm-hmm.
And when I'm doing laps swimming, to me that's a form of meditation because nothing else is going on while I'm doing that.
Yeah.
Okay. Any other comments you want to share as we, I guess the next one will be the last article.
I have a question about meditation. I pray, but I'm not quite sure how I understand other people when they say meditation. Does that mean you just let your mind go blank with nothing in it, or what?
All
How
of
do
the
they
above.
do that yoga meditation? You just
All
sitting
of
up
the
there,
above.
huh?
All of the above.
Well, how do you empty your brain out so it doesn't think?
Take a Tai Chi class. There's a lot of work.
It does take practice to clear your mind and not to follow those thoughts. They say let the thoughts that arise die a natural death.
Well, how do you do that?
Practice.
Practice just going blank?
Yes.
Well,
Okay.
I'll tell a thought, this is not your time, this is my time. So take that seat over there while I continue what I'm doing here. So the thoughts will come, but you'll tell it to go away for now. You can pick it up later. That's one way.
Okay. I don't, okay. I'm just, all right. I'm speechless because. All right.
Carol, I always fell asleep when I tried to meditate.
That's okay.
That's actually
if
good.
I do that and just empty my mind completely, I will be zonked out. I guess that
So
is meditating.
That's what
Okay.
happens to me.
That's
All right.
actually good. That's a good thing.
What, you just zonk out?
If you fall asleep, yes.
Okay, then I do that a lot in church.
Well, I think that that's why I say meditation because it can be either. It can be talking to God or it can be listening. It could be any of the above. So I that's what I call it when I talk about meditation because I talk to God and listen to God, and I think that all of the above I think is important.
Okay, Carol,
so
I'll
if I'm
help you.
not talking or listening, I'm asleep.
Sleep is
no.
different.
Okay.
All right, Carol, I'll help you with meditation.
Okay.
Not right now, but I'll get you through it. So next week you can report back on whether I said anything worthwhile.
Okay.
Only the truth will suffice.
Oh, you can bet on that.
Okay, the last article, because it was 10:30. Yeah, this is an article that I wanted to put in because many people underestimate the importance of stretching. We know about exercise and lifting and all of those things, but sometimes people say stretching is not exercise, but all of these studies have found out that stretching is exercise and stretching is important, that there are many benefits of stretching. So don't let people put you down because you're not weightlifting or doing some other things. Stretching is a benefit. And it also has morbidity and mortality consequences, which are positive. So continue your flex exercises and continue your weightlifting. They all result in gains in muscle strength. Some are better than others, but arterial stiffness is affected and performance is affected. So the bottom line is stretching exercises are good as well as other exercises. So keep it up, the stretching exercises. Any comments?
Keep moving.
Yeah, well, you know, one of the
Exactly
things
what I was gonna say.
that's always the best thing to do. One of the things, though, is that as we exercise, we often do get residuals of pain and other things. And sometimes after you do that, you have to stop for a while and then start again.
But the longer you exercise, the less pain you have. The pain will go away. It becomes part of you, I guess, or just it goes away once you.
But one thing is true though, is that if you have pain when you exercise, that's a sign for you to stop exercising for a while and
Oh
then
yeah,
start.
that type of pain. Yeah, yeah. But I mean,
And
like John said earlier about the bursitis in his shoulders, but
oh yeah, yeah,
once
yeah,
he started swimming,
yes,
it went away. That's what I'm
yeah,
talking about. So
yeah, right.
if you, whatever you're doing, you know, you continue to do it, the pain is going to go away.
Any closing comments?